Okay, so we're here with Eric Smith from Medicare Advisors of Alabama. We have been doing a whole series on multiple topics related to Medicare and what he does for people in helping them understand what Medicare even is and if they even need it. So our topic for this video is going to be avoiding common enrollment mistakes. Obviously very important. Based on what we've talked about already, I know that making a mistake in this realm, could really have a huge impact on your life. And so let's talk about how to protect yourself from that. If we're talking about someone that you would be working with. So let's start off with just saying deadlines, timelines. What are some of the deadlines and due dates and very important days that people just miss?
Yeah, no, absolutely. These are really important topics.
Yeah.
So a lot of times when you're turning 65, which is sort of the magic number, right? So there's important points of our life, 18, 16, 21, all these different timelines. But 65 is a really important number because everybody at that point becomes eligible for Medicare. And if you are still working, you may can postpone enrollment into Medicare. But if you're not working, or if you are working and you don't have insurance through your employer, then you definitely want to enroll. So there's a 7-month window that you're supposed to enroll into Medicare. There's 3 months before your birth month, and then 3 months after. But let's just say that during this period, you're still working, you have insurance through your employer, or you're married and your spouse has insurance and you're covered under a dependent under your spouse's insurance, then you can postpone that and you can enroll into Medicare at a future date. But one of the most common mistakes that I see is someone who takes COBRA. So COBRA is basically a continuation of your insurance at work. So let's assume that I leave work and my company offers me COBRA. Well, I can have COBRA for 18 months, which is fantastic. However, I am no longer an active employee. So when I'm not an active employee, Medicare requires you to be on Medicare if I'm not actively employed. But when I leave my group insurance, I have 8 months before I need to enroll into Medicare Part B. So you have a pretty good window. But it's not 18 months. So I have seen so many people over the years who leave work, enroll into COBRA, do nothing related to Medicare until their 18 months of COBRA is up. That's a bad mistake.
So now they've missed that 8-month window.
That's
completely.
Exactly right. And that creates a situation where potentially there's a new sort of thing that you can submit to Social Security to kind of explain, hey, I didn't understand this, and they give you a little bit of leeway on that, but it's really difficult. It's better for people just to get with us. Check to make sure that y'all are, that you're within the right timeline. And we just avoid those mistakes altogether. Sometimes we take those 8-month windows to our advantage. Like, for example, there have been people who I've worked with over the years who maybe are coming off their group insurance, but have met their maximum out of pocket on their group insurance. Maybe it's April or May, and they've already maxed out on their insurance, meaning that everything else for the rest of the year is covered at 100%, but they're also retiring. Well, we could take advantage of the COBRA rule. We could say, well, just take COBRA, extend that for the rest of this calendar year. We're within that 8-month window. And then enroll into Medicare for the first day of the following year. Which basically we're just taking advantage of the current insurance that you have.
There's no sense in paying if it's already paid out.
That's exactly right. And so you just have to know whether or not you can take advantage of a rule or whether or not a rule is going to cause you more pain. And it's impossible for people to know these rules. That's why you work with someone who can kind of guide you through that, just to make sure you're not making any mistakes.
Lots of nuance to it, and it all depends on the individual person.
Absolutely. I mean, there's very little that is just simple turn switch because there are so many different nuanced situations. And the rules are not necessarily arbitrary, even though they feel that way. Just simply because you're not working in the industry and it sounds foreign. But once you sort of understand it, all the rules revolve around coming off of group insurance and time to, how many months do I have before I need to do something kind of thing. Sometimes it's 60 days, sometimes it's 8 months. It just depends on what we're looking at.
Okay. That's great. And so we've talked about supplement plans quite a bit. And so let's just kind of focusing on those specifically. what are some mistakes that you see people make, or maybe they're about to make them when they come to you, just regarding supplement plans in particular?
So when you're looking at traditional Medicare and you're purchasing a Medicare supplement, also known as a Medigap policy, just that insurance plan that picks up what Medicare doesn't pay, I think the most common mistake is not really understanding what it is.
Yeah.
A lot of people think a supplement is Part C of Medicare. It is not.
Okay.
A supplement is more like car insurance.
So
when you think of car insurance, what is it doing? It's sort of just sitting in the background waiting for a claim to be paid.
Yeah.
And if you have a claim, you call your car insurance company and they pay that claim to whatever mechanic you use. Supplements are very similar. They're not a federal program. It's state-based.
Yeah.
So there are rules related to supplements. There's different versions of supplements. But ultimately, the state departments of insurance determine what insurance companies can sell supplements in those individual states. So I think understanding that it is more like car insurance, that when you go to a physician's office and you show your Medicare card, then a claim is filed, that the federal government, the Medicare system, will pay that claim, and then the remaining amount gets bumped over to your supplement, and your supplement picks up the difference regardless.
Okay.
So one of the things that happens is that someone thinks, well, if I have a Medicare supplement policy, I need to make sure that my physician accepts that supplement.
Right.
Or I'm not going to take this insurance because I don't think my physician accepts this insurance. Well, as long as it's a standard supplement that are offered throughout the country, as long as Medicare pays, the supplement's going to pick up the difference.
Okay.
Because claim gets filed and the supplement just picks up the difference.
Okay. Because it is both Medicare. I mean, it's not like it's a completely different thing.
That's right. And basically there's a system that says when your physician's office submits a claim, the supplement that you've purchased is essentially on file with Medicare, and it sees that it's sitting there, and they just send the remaining amount over to that insurance company.
So you don't even have to do anything.
Nope.
Okay.
You just show both insurance cards. You would show your Medicare card and your supplement card at the physician's office, and you really have no out-of-pocket expense.
Okay.
One of the other things that happens is most supplements since 2020 require you to pay what's called the Part B deductible.
Okay.
So we say a lot that you have Medicare and a supplement, you're not going to owe anything, but you do owe something initially. There's a deductible for Part B that is usually around $250, $260, something like that per year. That fluctuates each year. Some years it's, 270, 280. Anyway, it's somewhere around that deductible. That what will happen is you'll go to the physician's office. You won't owe anything because the doctor's office doesn't know how much you're supposed to pay until that claim gets ran through. And you'll receive a bill for 20% of whatever that office visit was until you have met that deductible.
Okay.
Once you meet that deductible, then your supplement picks up the difference. Again, very similar to car insurance. If I have a $500 car insurance deductible, then I've got to meet that before the insurance pays.
Yeah.
Very similar concept.
Okay. Yeah, that makes sense. Before someone enrolls in Medicare, maybe they're approaching 65 and they know that this is on the horizon for them. What are some of the most important things they need to double check? Like, they think they know something, but maybe they need to go back and look again. What would you recommend?
Work with us.
Okay.
Really simple.
Yeah.
Because if you can do a lot of research, and I have seen lots of people have a little bit of paralysis by analysis.
Yeah.
Right? I've done so much research that now I don't know what to do.
Or who to listen to, probably. Yeah.
Absolutely. Or I have, I'm so convinced. Like I remember some years ago, I was working with a person who, super nice guy. I went out to his house and he had this huge table and he had all this graph paper on this table. And I'm like, what have you done? And he's like, I know exactly what I want. I just want you to confirm that it's either this plan or that plan.
Yeah.
Right? So we go through this whole thing. He has all this graph paper. He's written down every single benefit there is of all these plans. And I look at this and I'm like, okay, so these are the two plans that you want? He's like, yeah, I just want you to tell me of these two plans, which one is best. And I said, well, who's your physician? Who's your primary care doctor?
Yeah.
And he said, whoever it was. And I'm like, well, I don't know you know this, but your doctor doesn't take either of those two plans. And he's like, well, what does my physician have to do with this? Your physician needs to understand what your insurance is, right?
Yeah.
So if I'm picking a Medicare Advantage plan, then I'm letting an insurance company administer my benefits, which is a very beneficial thing for a lot of people. But the number one question is, do my physicians accept this insurance plan?
Right.
So you can look at all the benefits and decide this is what I want to do. But the first question is, do my physicians accept this insurance plan? Right. What do they think when I walk into that physician's office with this card? Right. That's the number one question, which is a little bit harder for him to see on this graph paper.
Yeah.
You know? And so he did a lot of work, and I felt bad, but at the same time, I protected him from making a mistake.
Yeah.
Right? So I think that's some of the things. It's like you feel like you can do it on your own, which you can research a lot. And I always want people to research, but it's important to be familiar, but you can't be an expert with it.
Right.
And I think at age 65, just kind of assuming that either you don't have to do something or you've taken someone's advice, I would highly recommend just work with somebody who works in this every day.
Right.
Take their advice and combine it with what you've researched to make sure that whatever you're doing is the right thing. And that's the best advice I can give somebody who's turning 65. Attend a class that we do. We teach Prepare for Medicare classes, where it's sort of just as an overview of what Medicare looks like.
Yeah.
And through that, we'll give some pointers of, if you're doing this, then this is what you probably need to do, and that kind of thing. But that's, I think, the most important thing is just do as much research as you can on your own. But before you decide, hey, this is exactly what I'm going to do, work with an expert. It doesn't cost anything to do that. But then work with somebody that you can trust that's not going to try to steer you into one plan that benefits them.
Right. Well, and I think this is actually a pretty interesting point, because I think, you know, people might be wondering, well, should I do my own research, or should I just come to you and get you to tell me what to do? And it sounds like you're saying research is a good thing.
Yeah, absolutely.
Yeah. So as people are doing their own Googling on this, are there things they should look for where it's like, hey, that's a red flag, maybe don't trust that source?
It's hard to know that. I think that because there's a lot of people who do what we do and do a really great job. You know, I have a lot of peers in this industry that I respect a ton.
Yeah.
Usually when somebody comes to me and they've already met with an agent, my first question is going to be, who have you been working with?
Right.
Because if it's somebody who I know and respect in the industry, I'm like, oh, you're in great hands.
Okay.
Like, you know, I have a really good reputation in the industry. I never want to burn any bridges.
Right.
There are a lot of people, because, you know, this is how we make our living. Right?
Yeah.
Once we help somebody enroll into a plan, those plans pay us commissions, and that's how we make a living. There are some people that do a really great job. There's also people who are just like regular people who are trying to make a living selling insurance plans.
Yeah.
Even though they have good intentions, they may not be licensed with all the insurance plans.
Okay.
This is where the trick comes in.
Yeah.
We're not licensed with every single insurance plan.
Yeah.
But I'm more than willing to tell you about all the different insurance plans that are available. And then also tell you that maybe what you're already doing is the best thing for you.
Right.
It kind of goes back to treat others like you would want to be treated.
Yeah.
There is a person who, one of the guys that works in our office, was at an event, and someone came to them and said, oh, I know exactly what I want to enroll into. And when they told him that, they got into a little bit of a conversation about, well, tell me why you decided that. They had met with an agent who said, oh, this is the best plan for you based on whatever. They had no clue that, again, their physicians didn't take it, that the hospital that they were thinking about going to was not a network. What they were focusing on was just some big benefit, a dental benefit, or something that the insurance company was offering, sometimes just for that 1 year. You know, every year benefits tweak a little bit.
Right.
There's not like huge wholesale changes usually every year, but there are little tweaks here and there. And sometimes an insurance company will roll out a benefit that seems a little bit, you know, on the surface, like a little bit too much of a benefit to offer.
Yeah.
But if you're not in the industry, you don't realize that.
Yeah.
And so you're likely to enroll, but then the very next year that benefit is no longer there. So they've sort of gained in enrollment, but then the next year that benefit's not there.
The reason you enrolled isn't even active anymore.
That's exactly right. The thing that I sort of explain to everybody is we want to look at consistency.
Yeah.
And we also don't want you to enroll into a plan just because an insurance company has created a benefit.
Right.
It has a lot more to do with what's in my best interest, short term and long term.
Yeah.
And then if something happens in the future, how can I make a change?
Right. Okay. Yeah, that makes sense. As you're looking back over just all the people that you've met with over the years, people that have come to you for help, Is there anything that sticks out to you as, a certain mistake that you help somebody recover from in all of the stories that I'm sure you have?
Yeah, no, there's a ton.
Yeah.
Right. So what a lot of people don't know is what role Social Security plays with Medicare.
Okay.
We say Social Security, and most of us just immediately think check, right? Social Security check.
Yep.
But Social Security is a department.
Okay.
Medicare is a department. So when you think, and they're not connected, right? So when we think of Social Security, that is where we've been paying money to over the course of our entire lives to be eligible for that Social Security check.
Right.
But paying that FICA tax over the course of our lives is also making us eligible for Medicare.
Okay.
So when we turn 65 and we need Medicare, Medicare through the government is administered through the Department of Health and Human Services. But we have to go to Social Security to enroll into Medicare because they're the group that has the records that I have earned it. That I'm entitled to Medicare for having paid those FICA taxes, right? So the mistakes that I see so often is not understanding the role that Social Security plays, and also not understanding the timelines to be able to discuss with Social Security. You're not asking Social Security the right questions, not understanding how to apply for Medicare through Social Security, not understanding which forms to use for Social Security. It's its own language when you kind of talk to Social Security. And they've gone through a lot of changes the last year. And so I think one of the things that mistakes get made is turned in a form to Social Security, or I didn't send in the correct form to Social Security. They've mailed me something in the mail and I didn't know that I was supposed to do something. So these kinds of things that people, just the lack of understanding and the role that Social Security plays is really important, and how to communicate with them is really important. They do a really great job. Hats off to what Social Security does, but they're working with so many people in so many different situations, and Medicare is a small piece of what they do, and it's a huge chunk of what we do. So one of the things that we provide is what forms do you need when you're leaving work, how to apply for Medicare A and B when you turn 65. What if I wanted to delay enrollment into Medicare? What if I missed an enrollment period? Is there something that I can do to communicate to Social Security to be able to get that back? What if I missed a payment? What if I don't take Social Security and I have Medicare? Well, if Medicare has a premium, how do I pay that? These are the questions that I see often. And not paying attention to actual mail that you get. Because that's the other thing that happens, is that I've enrolled into Social Security, I've got Medicare, I'm not drawing a Social Security check, and I get so much junk mail in the physical mail that I'm actually not paying attention to what I get. And I get a random invoice from Medicare that says I owe some money, and I completely forget about it. 4 or 5 months pass, I haven't made my premium payments, and you'll be disenrolled. And that's a problem.
That's pretty serious.
Because if you get disenrolled from Medicare, it's not like you can just quickly call up and be like, hey, let me pay it back. You can do that up to a point, but after so much time, there's nothing you can do. And they don't continuously send you late notices.
So they just won't take you back at a certain point.
Yes.
Oh, boy.
And you have to fill out some forms that basically say, I've got this extenuating circumstance. But often I see that hardly ever work.
Really?
Because it's like everybody has extenuating circumstances kind of thing. And how do you, it gets a little bit convoluted. So that's one of the things we stress to people is do an automatic deduction. Let us help you set up a Medicare.gov account. Let it just be bank drafted. If you're drawing Social Security check, it's much easier because it automatically comes out of your Social Security check. But if you're not drawing Social Security, our advice is to just set up an automatic deduction so you don't have to worry about, did I make that payment? But these are the kinds of things that we've helped people with. But it's also the most common mistakes that you see. Just not being informed, and then having so much going on in your life that, it's easy to forget something, and then it's sort of too late to fix it.
And then there's huge consequences, and you just weren't prepared for it.
Huge consequences. And it's not that anyone's out to get you, it's just what happens.
It's just the way it works.
Life happens. That's why working with someone who can sort of guide you through that to make sure you're not making those mistakes, and to make it as simple as possible, to kind of say, hey, here's some things that you need to be concerned about. So let's go ahead and fix it before those things happen.
That's great. Sounds like a lot of what ifs that you help people answer, which is amazing. We've been talking with Eric Smith about common mistakes with Medicare and avoiding common enrollment mistakes and how his organization, Medicare Advisors of Alabama, can help with that. If this video was helpful to you, make sure you check out the rest of the series. We're doing a whole series of videos on this topic. And if you would like to have a real conversation with Eric, just reach out to him. Medicare Advisors of Alabama is the name of the company. He would be happy to help you, I'm sure.
Absolutely. Or anyone on our team.
Yes, anyone on his team, not just Eric.
Absolutely.
Okay. All right. Thank you for being here. We'll see you next time.
Awesome. Thank you so much.